a presentation for us on some of the open source simulation modelling that she has done. So excellent. Can I hand it over to you then?
Thank you very much. Is my mic switched on? Yes, it is. Great. So thanks for coming to our session, first of all. So we've only got 45 minutes, so I'm determined that we squeeze every last ounce of value out of this, particularly in terms of getting some engagement from yourselves and dealing with your questions. So we're going to have two very short presentations, and then we'll open it up for questions and discussion. So first off, Philippa Lynch from Partners in Care and Health, which is a kind of joint improvement body set up by Local Government Association and ADASS. Philippa, over to you.
Morning, everyone. Just see if I just go next. Yes. This is quite a novel experience, standing up instead of doing Teams meetings, so this is get used to this now. Right, I'll be very brief, but I just really wanted to provide a bit of background about Partners in Care and Health for those that don't know anything about it, and also our role, and then linked particularly to Pete's role as one of the ADASS regions. But as Richard said, I'm part of Partners in Care and Health. It was previously called the Care and Health Improvement Programme. I lose count of how many years we have been around for, but it's essentially a sector-led improvement programme that's funded by government, predominantly by Department of Health, and it's a joint partnership between ADASS and the Local Government Association. But more recently, we've also gone into a contract partnership with SCI, the Social Care Institute for Excellence as well. So long-term project, lots of activity, but it's very much working with the sector to find out what support is needed for adult social care and working with them to try and share learning and innovation and take things forward. So in terms of my role within Partners in Care and Health, I lead a small team of analysts. I think the world of data in adult social care has changed since the pandemic, and that has been true of our programme as well. Previously, we only had about 1.8 people in that resource, but Department of Health in particular have seemed to much keener to have an interest in adult social care data. There's a lot more activity and engagement in that, and as a consequence, we now have a team of 5, which is great because we can do much more with the sector and try and build some of the capacity in that is the capability and capacity across the sector is stretched, so it's trying to get the economies of scale where we can and try to drive things through and do what we can to support the regions and support councils as well. So I won't go through all the points in detail, but essentially we work with the Department of Health in particular, work with the sector to try and make sure that if there's any data initiatives or new data collections, performance monitoring or whatever in that space, we try and make sure we work between the department and councils to make sure that it works for everybody, that it's not a burden, that it's more of a benefit than a cost. So really having that engagement to help civil servants understand the pressures and the complexities around adult social care and making the data work in that space. Keep forgetting I've got a screen down here as well. Within the programme then we try and develop a number of products, whether those be self-assessment tools or insight surveys, but also benchmarking reports as well, so that people can engage with the data, easily access it and make use of it. So we're giving people a head start when they're trying to do anything with data in adult social care. And one of the key things, particularly going forward, is trying to make that engagement with senior leaders. I know there's a lot of analysts in the space today and yesterday, but it's how do we get data to people that are making the decisions? How do we get people to understand it, have that curiosity and want to do more with data? We're really pleased that as part of the Partners in Care and Health programme support, we've set up a network from May this year, and I think this will be pretty key going forward in how we maximise the use of data in adult social care. And what we've done, we've brought together, we need a better title, but it's a strategic data and intelligence network which brings together representation from across the sector, but trying to bridge both analytical, strategic, frontline inputs so that we can talk about things that matter to data, but embedded in practice, embedded in improvement, and making sure that whatever we do with data collectively with the Department of Health and NHS England, that it's coordinated, it's something that the sector can feed into, can shape to make it work. So it's very much about driving I think Richard referred to in one of his slides, the power of data and making sure that that works. And it's making sure that the sector has a key role in developing that. So we're really pleased that that is set up and will be that conduit of information and information sharing and feedback with the sector and policy development. Very briefly here, and I'm happy to share links later as well. Richard, again, mentioned this earlier. We have a benchmarking platform in the Local Government Association called LG Inform. I won't check, because I can't see everybody's faces or hands, how many people know about it, but it's really worth checking out if you're ever working with local authority level data. So it's a massive database, covers all local government services, but particularly for adult social care, we've tried to build up that resource there. So it's, again, gives analysts in local authorities a head start, so they don't have to go scraping data from all the published sources. We bring it into one place. You can create your own reports if you're a local authority user. You can access a ready-made report if you're going in. But it allows you to benchmark, compare with different comparison groups, but it's very instant access to data about social care in a way that helps to give that insight and information without having to knit together lots of spreadsheets. So please do have a look at it. It works very well for us, and I'm sure it will work for everybody else, but it's a really powerful tool for pulling that information together and presenting it in a way that engages with people. So just briefly, just wanted to touch on what's happening in adult social care, because as I said, I think it's post-pandemic is probably the starting point, but there's a lot of activity in adult social care, and we had the Care Data Matters, which set up the roadmap for better adult social care data. It's still, I think it's fair to say, still at a fairly early stage, but life is promising in the world of adult social care data. And it's really key that the sector engages with this, that we also bring in health partners as well, so we can look at getting better use of the data that we use, whether it's for statutory reporting, performance monitoring. It's making sure that it works and gives us those insights that help to lead to better decisions across the piece, so locally, regionally and nationally. So we will be, there's already a revised adult social care outcomes framework, but that will be revised again very soon. Really key, and I'll come back to it, is client level data, which is a new method of extracting data from local authorities' case management systems to underpin the statutory reporting. And I'll come on to it in the next slide. There are so many opportunities that we can draw from that going forward, and it could be so powerful in terms of giving us that insight and information about what's happening to people's lives and outcomes. There is a commitment to revising the Adult Social Care Survey and the User Survey, and I won't speak officially on behalf of the LGA, but collectively with colleagues across ADASS and councils, I think our feeling tends to be that it would be much better if this was a nationally driven survey, and to look at the scope for extending this, so it's not just about those that are currently receiving adult social care from the councils, but to look more broadly, potentially linking up with health surveys as well, so that we get a better understanding of population's needs, unpaid care, self-funders, unmet need. There's so many things that we don't know about the people that aren't already in touch with services, so it's looking at the opportunities that could present. And then linked with that, digitisation is moving forward at a pace, and I think that will also then help us to draw data. I was very excited to hear about the administration records and the work around that. There is so much more potential to do that, and I think digitisation of social care records will certainly help with that and give us something to mine for insights. So I mentioned the client level data, and hopefully this is something we can pick on in the conversation later on, but essentially we had a statutory collection that was reported to Department of Health every year, aggregated data from local authorities, the main one being the short and long-term support, so looking at people who are receiving care. Instead of that, from April 23, there has been a quarterly extraction of data from adult social care systems that then, as the first aim was to replace the SALT, short and long-term collection, but it has the potential then to give us so much more data to create headline metrics that could be used for performance monitoring or insights, but more than that, and I think this is the potential, as it develops over time, and we've got to recognise there are quality issues now, but they will come out in the wash, so to speak, as we start to test it and start to use it. But it's that ability to link it with health data, link it to other administrative data, slice and dice it by whatever means we want to, locally, nationally and regionally, whether it's by age, conditions. There are so many ways, really powerful data set. And I think one of the key things when we look at the capacity and capability within the sector, it has to be something that's owned more widely, that is looking at where we can get those economies of scales, engaging people who are working in research to really help to mine that data. So it's probably the most exciting thing that's happening with adult social care data going forward, but we have to maximise. So I think it'd be useful to get some feedback later on the sort of insights that we would want to draw from that. And it's key to say it's not just about metrics or indicators, it's what research and insights we can draw from it. So just briefly to move back to let Pete have a chance to speak. But future vision, I think the key thing is that we look more about people and place, that it's not about organisations, and particularly as a local government sector, we really do need more access to person-based health activity data so that we can understand how that relates to where people live. And that's within local authority boundaries, so where possible, going down to smaller area boundaries, linking with deprivation data. So it's really key that we start to be able to get that information out of the health systems and into local government so that we can have that shared insight and start to unlock some of the potentially the client level data, but also start to be able to ask questions of it and draw insights from it. So I think the key thing is place, people, and looking at outcomes as well. So it's and drawing where we've got technology, both in terms of data systems, but also technology-driven support. That will also give us some insights, and it's key that we draw on that to make a difference to adult social care. So finally, and then I will hand over to Pete. Key aims, we have got a new assurance process in place in adult social care, CQC driving that, but it's key that within that, the self-assessment is used to drive improvement, shape the narrative for adult social care. So working with CQC to make sure that it makes a difference. It's not just a tick examination type approach. Key that we use the data that we've got to evidence the impact of adult social care, and that's both economic, but also the impact on people's lives and how it makes a difference to society. So I think just jumping ahead, my key thing is that I love data, I love playing with data and all the numbers, but I think the key thing is that we draw the insight from the data that we've got, and to make sure that it does have that impact, and that we can use it to derive some actionable insights that can lead to decision making. So I will leave it there, and I shall hand over to Pete.
That's great, thank you. So next up, Pete Jackson from West Midlands ADASS. Pete.
So two things that I'm really pleased about this morning. One is that this event's taking place in Telford, which is where I actually live, so I've only had 2 miles to travel this morning to get here. And secondly, it's great to see some faces from the strategy unit who we've been working with as West Midlands ADASS for a number of years now, and really wanted to start by saying thank you really to the strategy unit for making sure that social care has got a place on this agenda, because I think it's something which actually those of us who work in social care really do appreciate, and acknowledgement really that social care, as Richard's outlined, has got a massive place to play in terms of how we operate. So my slides are really there's quite a lot of pictures really, and that's probably the way I work. But I want to start by describing some of the work that we've been doing with the strategy unit over the last 2 or 3 years really, and they helped us to undertake an exercise, scenario planning exercise that we started involving all of our 14 directors and councils in the region, thinking about what would a resilient social care system need to look like in 2035. And it's quite unusual really, I think for social care and possibly for health these days, to be able to take time out to think about the future when everything is so pressured and urgent. But that exercise has been really helpful to us in thinking about how do we position ourselves going forward, and what we've described as 6 capabilities that we want to we've started to develop really in terms of how we prepare ourselves to make sure that whatever the scenario, whatever the outcome from the election, outcome from war, outcome from pestilence and disease around the world, and what impact that has on us in the UK, that we've got some thinking around what are the key components which we need to have to be prepared and resilient to those things. And the first one of those things was around the story, really. And we talk a lot about the narrative in social care, about often, and Richard started, I think, his session this morning by saying it's often described to be about the money, and that clearly is very important. But it's also, I think, what we've sort of realised is that the impact, the experience, the involvement of people who use services actually is very central to what social care is all about. It's about promoting independence, but also about meeting the individual and personal needs. And that often is quite difficult to quantify. And so one of the terms that we've been starting to use is how do we use the data really to describe the lived experience of people using services. And that's an area I think that we were really keen to develop and work through. The second one, and I think this is again why I've said thank you to the strategy unit, collaborative working. We often work in our own little silos, whether it be in an authority, whether it be in a trust, or whether it be in the voluntary sector actually. And what we have sort of realised through the scenario work is the importance really of looking beyond our immediate partnerships and partners and starting to look at what's the military doing, what are they learning about technology, what are agriculture, what are those industries doing that we can learn from, rather than just repeating the same things that we've always done over time. And I suppose we've been extending that work, particularly with, say, the strategy unit, but also with the academic institutions in the West Midlands, to start thinking about how do we sort of forge relationships which have meaning and add value to our individual approaches. Big thing for us as well is around, we use the term co-production, patient involvement, involving people drawing on services. And that's, I think, been something which has been, over certainly the last decade, something which has not had the profile that it probably had previously. So we're thinking we're working very, very much in terms of building capacity and capability amongst people who are drawing on services, how they influence what we do, but increasingly adding to that their voices, their individual voices and anecdote, by trying to think about how do we use data to make that voice louder and more credible and more significant to the way that services are supplied. So we're very keen about that whole community engagement, advocacy, working with people drawing on services. What this sort of conference partly shows to me is really, and sort of coming in the door and seeing, 600, whatever it is, analysts, is that in social care, when we describe the workforce, and Richard did it really well with the one slide, is that we talk about the carers, actually, which is an enormous big number. We talk about social work, occupational therapy, nursing as 5% of the overall workforce. But actually things like data analysts, people who actually are providing what might be described as back office support, are often really overlooked. And we think that it's really important that whole community of social care professions activity is promoted. So we've been doing quite a lot of work around thinking about how we promote the roles of analysts in social care, of networking those individuals. I'm really pleased that we've got two of them in the audience today, Caroline from Shropshire and Tracy, who actually, an apprentice, but also somebody actually has been really great in emphasising that data can be really important for social care and can be a force for good rather than a force for negativity. We all see the opportunities around technology generally and AI, and we're all thinking about the phrase that we've termed is around balancing technology and humanity. The fact that compassion, love, caring actually are integral to the care system, but often aren't necessarily seen as being replaceable by technology, and fear around technology replacing those human interactions. But actually we also think that for technology, assistive technology, to get a stronger input into social care, then we need to be measuring, we need to be able to demonstrate the evidence that having a trip and fall sensor in the home, or an ability to use telecommunications with your GP, whatever, what impact that's having to help sell the case for it and to demonstrate that this is something worthy of investment. So really interested in how we're using data to measure those sorts of things. And then Richard in his slides talks about this work that we've been doing around our data hub, which is something, again, 5 years we've been building this, really thinking about how do we make our data more accessible, how do we make sure that our leaders are using it, have got it at their fingertips and are able to access it and feel comfortable in using it, how do we draw on all of the different types of population health data that's out there and combine it with some of the data sets that Philippa has described that are available to social care, the short and long-term data, some of the things that we do count on an annual basis through the surveys and ask off the performance measures. So bringing that together, but making it in a more dynamic way, which we can cut and shape to impact on the things that we're trying to influence. And then three things really at the end really. We definitely think about, often we all think about outputs, what difference are we making? We often don't see the fruits of our labour in terms of what impact it's having. So we've been very much thinking about our data in terms of assurance. So coincidentally, the CQC are in Telford today doing one of the first local authority assurance tests, and we've been using our data again to help inform the preparation for that, but also to help them tell their story. We're obviously very keen on benchmarking and people knowing who's doing better and how do we match people up who are doing. People often aren't very keen on volunteering to say they're doing better because it means they get loads of visits from people who say, how are you doing that? But people very much welcome, don't they, being able to compare themselves with their neighbours and with their partners. So we're very keen on that. And really keen and really pleased that Sally's going to be talking next around modelling, because we think that's one of the areas about looking into the future, about planning and preparation for future needs that we've generally been pretty bad at in social care. I'm not saying you've been particularly good at health, but actually we've been particularly bad. So we think building capability in that area is something which we're really keen to build on. We know it needs investment. We know it needs people to be able to do it, but starting in small ways to put the toe in the water to see what that might mean. So we're really keen to develop those things. And just the two things there, international recruitment, practical things. We've been really good as a region in terms of turning that data into things that we can use, and we're providing information for the whole country now around international recruitment, which has been a particularly contentious policy area within social care, but actually using that evidence-based approach to demonstrate how that is impacting on the workforce in regionally and nationally. Some really good things that I think we feel that data is playing much more of a part in our programme within the region. Definitely about sort of sharing good practice capabilities and initiatives. I think that we're seeing, and why we are particularly pleased again to be here, because we think that as a region and seeing some of the posters around outside, lots of examples from the West Midlands of health and social care doing things together around this agenda. And then finally, and this final slide actually, is really about the photograph, which is about a group of people with learning disabilities who we supported to do a project around deterioration and constipation. And they actually did their own research where they designed their own questionnaire. They actually did, sort of promoted the questionnaire, got over 500 responses, and actually then produced a report and presented it back. And we thought that was a brilliant way of explaining how the importance really of people with lived experience being able to influence and share their lives, but also developing the skills and capabilities themselves of how to use data and use it to influence authorities, but also hopefully influence the way that social care and health go forward. So that's my talk for today.
Thank you, Pete. Thank you, Philippa. So two very crisp, very clear presentations, lots to get our teeth into. So what I'd like to do now, we've got about 20 minutes left according to this little ticking clock down here, which I completely ignored when I did my presentation. That's why I got into trouble. So if we could have a couple of questions, we'll take take them together, and maybe if I could ask the support team to kind of come up with some questions from Slido as well. So we've got our online colleagues able to take part. So quite difficult to see you all with the slide. Have we got any hands up? Yeah, somebody down here. We'll take two at a time, I think, and then give Philippa and Pete a chance to comment. Could you tell us who you are as well, please?
I'm Jenny Wood. I work for the strategy unit. I used to be an analyst in social care, and now I'm working in health, and I'm kind of struck by the cultural differences that have come out in the way that you're discussing and in the conversation this morning. Lots more talk about lived experience in the social care world, lots more maybe resistance to recording and data quality questions. And those challenges about how to aggregate that information up into useful ways for decision makers. And I wondered if you had examples of times where you've seen kind of mixed or combinations of lived experience, but with quantitative data behind it that's made a big difference, or any advice on how to do the right kind of analysis that can support both of those things.
That's a great question, Jenny. Thank you.
Okay, there's one up there. As I walk up these stairs, I'm going to attempt to parrot two from the online thing, and then arrive there. So you're going to end up with more questions.
Okay.
There's two questions here that are about the client level data set. How's it going, and how do you ensure the quality of the client level data that's coming through? And do you have any feelings on how good or otherwise the quality of that data is? So that were the online ones.
Okay, we've got that. That's number two. Yep.
Oh, hi, sorry. Sarah Parsons, I'm Health and Research Lead at an organisation called HACA, which is the Housing Association's Charitable Trust. Very interested to hear Philippa talking about the importance of people and place. And I'm just interested on the panel's take on what we often experience in the work we do at HACT in brokering the relationships between health, housing and social care, is that there does, whilst operationally it seems to be, improving in working with social care, strategically adult social care are really hesitant in engaging, and we've seen that in a couple of projects that I've been working on recently. And I'm just wondering if there's any thoughts about why that might be. I mean, we work with a lot of housing associations, and certainly Black Country ICB have nailed this really. But they talk about your people are our people, and I think that's what we need to remember. We're different sectors, different organisations, but it's the same person. So any ideas on hesitancy?
Thanks. Another good question. Thank you, Sarah. So we've got three questions there now. So the first one was from Jenny, which is about cultural differences and this sometimes kind of resistance to recording, capturing data and so on. Pete, that's probably one for you, isn't it?
Yes, so it is a really good question. I suppose it goes back to the qualitative and quantitative discussion, doesn't it? And talking about social sciences against, I suppose, medical science. And we've been very much in the middle of that, Jenny, recently, where we've been, doing programmes, particularly with working age adults, people with learning disabilities and autism, where the strength of, I suppose it can be described as anger and, really strong views about how people have been mistreated. Social justice plays a big part in term that plays a big part in our work. And when you hear those stories, and then you see the difficulty often in getting the data to correlate or to, that's where I think that's a really interesting area, well, a really important area that we're trying to, and we want to do more on, because I think bringing those two things together, one without the other, doesn't make sense. So I think we're really keen. I think on the point about hesitancy, again, around the use of data, I don't know whether Philippa would agree with this, but I think there's generally been I suppose the data being used defensively, of not being accurate, not being up to date, underinvestment in those professions over the past decade or so, and that being something which again is going to take some time to turn around. But I think there are signs, and we're really keen on, again, the principle of sector-led, peers working together, building networks of people. This is a brilliant example of where you start to get people with common interests collaborating with each other and starting to share their knowledge, skills, experience to build that sort of capability and strength within the sector. So I think it's a big area. Jenny, really very keen to follow up with that if you're interested.
Okay, thanks, Pete. Philippa, the second question was really about the client level data set and how we're doing with that and what's the quality like.
So it's going well, I think. It's been going for a year. There's I have to commend the team at Department of Health and Social Care that are leading on the analytics. They are very closely linked into a number of user groups with from the sector to test out different areas of the metrics. But it's been progressing. We've got a whole year of data and all councils are contributing. So, tick one, we've done the fundamentals. I think in terms of the quality, it's really important that we start using the data set early, but we use it wisely. And I think that's the key thing. It's having that interaction, and relates a bit to what Pete was saying in the last question. I don't think there's necessarily a resistance, but it's as long as we're working together to have the right aims. We know what it tells us, what it doesn't tell us, how it should be used, how it shouldn't be used. And I think if we can have that conversation, we can then progress it. And what's key with the client level data at the moment, they've published one set of data around long-term support because that is consistent with what we knew from previous collections. So there's a bit more confidence in the comparability. But there is other work going on in the background. Local authorities all have access to a view of their own data to test out some of the metrics. And one of the key things we're looking at the moment is around waiting times, which is very contentious. So there's a lot of work going into to test out that, do councils recognise the data? What does it mean? How can we use it? So the quality will improve, and nobody can expect it to be perfect from the outset, but we can't put it in a box until it's perfect. So it's making sure that we start to use it. And I know that a lot of ICB colleagues have been drawing on that data. So it's really important to work with the councils to make sure that it's interpreted correctly and used correctly, but keep testing it, keep pushing it, and it'll get better. But it's a really good start.
That's great. Thanks, Philippa. And the third question from our HACT colleague was really about the work involving housing providers, and where there was a suggestion that it was hard to get adult social care involved. Pete, would you want to comment on that?
Yeah, I think, housing clearly has a massive impact on people's lives and for social care. And the strapline of wanting to keep people living at home independently as long as possible is a key indicator that housing is really important. And we've all been doing work, and we were hopeful, had some hope, I think, during the last government around reform in terms of housing being a particular area for investment. I think that the fragmentation in housing around what some councils still delivering social housing, different models emerging, but obviously the strength of the housing associations really in terms of providing supported living, etc. Make it a multiply complex environment. What I suppose I'd point to is the importance of the language around, and this is where, again, over the years, sort of thinking about tenants, thinking about patients, thinking about citizens, thinking about people, that actually we do that thing about keeping people to ourselves and thinking that we're responsible for them with their particular condition. And the move that, that Philippa mentioned around the importance of place, how we bring together people in places to come up with solutions that are appropriate for their local needs and for their I suppose the environment in which they're working is really important. So I think we've all got to work really hard on that. Collaboration between our respective organisations takes time, it's hard, but actually we need to go into these things with a far more open mind than I think we have done in recent times.
I must admit, I was disappointed to hear the. Thank you for asking it, but I was disappointed at the suggestion that social care is sometimes difficult to engage, because in previous surveys of directors, housing with care has been seen as one of the solutions to our pressures and problems. And from my point of view, I think one of the most exciting areas of innovation is finding housing-based models of care. So maybe we could pick that up afterwards and pursue that. So we've got time for another couple of questions at least.
And there's an absolute beauty which you're going to need a minute to think about. So I'm going to give it you now and then wander across. To pick
Okay.
another one up. This is from Josephine Browning. She says, if you had access to high quality linked adult social care and health data, what would you ask of it to unlock the most value? That's the thing we hear from our analysts at the unit all the time is, can you give us good questions? So like, what would the good questions be?
Good questions.
And then let me, well, I've been pre-gestured this way. So, well, you want me to take a couple maybe from the audience?
Yeah. We've got 9 minutes, I think. But yeah, please be brief. Yeah, thank you.
Hi. So Therese Lloyd from the Improvement Analytics Unit at the Health Foundation. This is unfortunately not a question, it's a shameful plug, but it feels
Okay.
I hope I'm justified in doing this. So we're just coming to the end of a large NIHR-funded project called the DACHA study, DACHA. Which actually was creating a proof of concept minimum data set for care home residents, and we managed to link the client level data set that you're talking about with healthcare data, secondary care data, ambulance data, CQC. I'm forgetting a couple, but also crucially digital social care records. So both data that is collected routinely by care homes, but also with some additional linking to the question that was asked earlier on quality of life. The project is coming to an end. We've got lots of preprint papers out. So if anybody is interested in seeing what the potential is of bringing this together, do please look into that.
That's great. Thank you, Tracy. DACHA is a fabulous project, and thank you for for raising it. Okay, let's have a final question.
So, and actually, this is also more of an information and a plug rather than a question.
Okay, right.
Timing. I'm Dina Ledbeater. I chair the Health Stats user group, and adult social care statistics is really important, and OSR obviously flagged up problems, and we facilitated a webinar a couple of weeks ago, bringing together the various people who produce adult social care statistics across the UK and also some councils. With lots of links as to where you go for further information. And also colleagues from NHS England said they're setting up, there's a user forum, and they were wanting people to participate, to make comments so they can improve the developments. So that material will be posted on our website. And I think what I'm going to suggest is that the best thing to do is Philippa can have the links to that. So if you're going to look at what she's got on LG Inform, you'll also be able to access all the material and the links and an overview of what actually is being produced and what they're planning to produce to improve the situation. So that's a sort of collaborative connection thing.
Thank you, Dina. So that's a bit of showcasing going on here, which is great. That's the whole purpose, sharing information and ideas about what's happening. So the question from Josephine essentially was, if linked data is the answer, what is the question? Isn't it? That's what it amounts to.
Yep.
Philippa, I could think of no better person to attempt to answer
So
that.
we've been trying for years. But I think the first thing is healthcare data and beyond. And I was really excited by the earlier presentation. Benefits, housing, they're all key. So I think broadly, and I'll come back to specifics, but it's, you're following your curiosity. It's the who, what, the where, the why, the how. It's just being able to follow those pathways through life's course, through interactions with health and social care. So it's be able to follow that and understand the characteristics of the people, characteristics of the place and the services they have and they haven't got, and characteristics of their needs. So it's using that as a context, and it's starting with some key questions rather than measures. But I think if we were to start with some high-level data, it goes back to one of the points that Richard raised earlier about not having access to data on hospital discharge. So just knowing some people-related information around that interaction with emergency admissions, the discharges, the readmissions, what happens next, would be really key, because even with we had the delayed transfers of care data set, which had many imperfections, but what it did allow us to look at was to break it by health organisation and local authority, so you could slice and dice to really look at where the pressures were and by the reasons, just to have those questions that then drive to further action. So the data will never give you the answer, but it's enough to give you those prompts to say, what age group, what are the characteristics, what are the commonalities that we then need to address in order to make a difference.
Thank you, Philippa. We're almost out of time. Pete, did you want to
I was going
contribute
to say, I think the question about what question to ask, I think there's two things that I'd flag up. And one is about the importance of domiciliary care and people staying at home. And I think possibly one of the questions that we've been trying to answer with the strategy unit is around what impact having people living at home longer or getting people home longer has on the costs of care in acute hospitals, because I think that's one of the fundamental questions that we face. And the other area which I think is massively under evidenced and researched is the role of family carers. We know in the West Midlands like 500,000 people actually who are looking after a family member or a loved one. But actually, what do we know about what would make a difference to those people in terms of their resilience and their long-term ability to keep looking after people? So I think these are questions for social care, which were often phrased through a health lens, but actually we need to sort of try and switch that lens around the other way, would be my opinion. But
Pete, thanks. So I think we're out of time, aren't we? So I just wanted to thank you for your engagement, your participation, some really good questions. And this is a journey, to use that cliche. But there's some great work going on, and some of your questions reflect that. So please keep it up, and let's try and get that data linked together more effectively in future. Thank you very much. Thank you.